Good morning, everybody.
Morning.
I'm pleased to be joined by Commissioner Dennis Deere, Commissioner Bill Lowry, our CEO, Israel Rocha, Valerie Amos, the Health System's Chief of HR, and Joe Flanagan, the Chair of the Cook County Health Foundation. And David Jones will be doing our sign language translation today. Thank you, David. We've come together today to announce a very exciting endeavor, the creation of the Provident Hospital Scholarship Fund. This fund, in partnership with my office's Project Rainbow, is designed to address educational barriers and will support students entering the medical field who are from and seek to give back to underserved communities. With our sights set on creating a more equitable health system that provides high-quality, culturally competent care for all, we must ensure that our healthcare workforce is reflective of our communities. We know all too well the systemic and ongoing inequities that impact communities of color across Cook County. Only 5% of the doctors in the United States are African American, and fewer than 6% are Latino. It's essential that we lift up students who may not have as many academic and economic opportunities and support for their aspirations for a career in healthcare. It's the right thing for the nation's healthcare workforce and the right thing to do for our patients. We've named this scholarship program after our very own Provident Hospital, which we all know has a significant history in this country. Provident was founded in 1891 by Daniel Hale Williams. It was the first hospital in our entire country that was owned by African Americans, and it cared for people of all races. Dr. Daniel Hale Williams performed the first successful open-heart surgery at Provident in 1893. The hospital joined the county health system in 1991, where it continues to fulfill Dr. Williams' vision of being a true community hospital for the people and by the people. The Provident Hospital Scholarship Fund is a partnership between Cook County Health, and the Cook County Health Foundation. The Cook County Board of Commissioners has committed $1 million of funding to support the scholarship program, and I'm proud to affirm the county's commitment to continuing to fund the program in subsequent years. I'm grateful to the Cook County Health Foundation and its donors for generously supporting the program. This is one of the many ways we're striving to promote racial and ethnic equity across the county. Through my office's Project Rainbow initiative, we are committed to high-quality educational programming, events, and initiatives, like today's historic Scholarship Fund announcement, that inform, inspire, and impact children, students, and families throughout our county. For more on Project Rainbow, please visit projectrainbow.cookcountyil.gov. That's projectrainbow.cookcountyil.gov. I'd now like to welcome Commissioner Dennis Deere to the podium and ask again that each speaker announce the person who follows.
Thank you, Madam President. My name is Cook County Commissioner Dennis Deere, Chair of Health and Hospitals, and it is a delight to be here with each of you on today. Why? Because you just heard Madam President talk about who this scholarship will impact. Well, 30 years ago, I was one of those kids from Lawndale, considered an underserved community. Parents were really, really poor, but I wanted to go to college. And there was organizations like the Urban League, like Better Boys Foundation, and now Cook County Health System, Cook County Government, and Cook County Foundation that's supporting our youth. I wouldn't be where I am today having gotten monies like what we're giving away today in Cook County. And this is money that was given to somebody that came from an underserved community, and it helped me, it propelled me, not only through a bachelor's degree, not only through a master's degree, but through a PhD. And now I'm giving back in public service as a Cook County Commissioner and Chair of Health and Hospitals. So this is exciting. It is a delight. There are going to be people who are going to be impacted majorly from underserved communities, and I'm very, very excited to put in this work, and even more excited for the dreams and the stories that we will hear from them, and hopefully they'll do just like I did, come back and work in Cook County. Now you'll hear from a dear friend of mine. I don't go shopping without this brother because we work together all the time. None other than Cook County Commissioner Bill Lowry.
Commissioner Deere is absolutely right about that. I am Bill Lowry, Cook County Commissioner of the 3rd District, and welcome to all of you here to the 3rd District and to one of the gems of our district, that's Provident Hospital. The word provident is defined as making or indicative of timely preparation for the future. How better to embrace the boundless futures of our high school students, our undergraduate students, and our grad students than through the gift of education. With the President, with Cook County Health, with the Cook County Health Foundation, and with the Board of Commissioners, I stand before you today proud. Proud that through the Provident Hospital Scholarship Program, we are investing in our students of today, as well as our healthcare leaders, our physicians, and our dentists of tomorrow. To all of you, be safe, be healthy, be blessed. It is now my pleasure to bring up the CEO of Cook County Health, Israel Rocha.
Good morning, everybody. Good morning. Good morning. It's a pleasure to be with you today. I'd like to start by thanking President Preckwinkle, Commissioner Deere and Lowry, and the entire Cook County Board of Commissioners and the Cook County Health Foundation for their tremendous support of the new Provident Scholarship Fund in making today possible. I'd also like to recognize Valerie Amos and Alicia Boyd and the Cook County Health team who have been working hard to launch this exciting new scholarship program. Thank you to your generous support of Cook County, the foundation, and its donors. This year we will be able to support 60 high school, college, and medical school students who are from and want to work in the underserved communities in our county. Nearly $1 million. Nearly $1 million in scholarships will be given out this year. Applicants will be evaluated on their academic achievements, and consideration will also be given to the candidate's community and where it falls on the Social Vulnerability Index. The goal of this program is to provide opportunity to students coming from communities that have historically faced greater challenges, be it education, economic opportunities, transportation, access to food, or medical care. As you know, our nation is facing a workforce crisis, especially in healthcare. We must develop a pipeline of talented, committed care providers who want to serve the neighborhoods they are from. Our own Cook County Health System serves a minority patient population that is the majority of our patients. 31% of our patients are Black and 28% are Hispanic. I am proud that our care team is representative of the people that we serve. 59% of our staff are Black or Hispanic. However, our diverse team is an exception in the healthcare landscape, not the norm. Having healthcare providers who understand, who look, or from the same cultural experiences as our patients often results in better healthcare outcomes. Evidence shows that when providers and patients are of the same race, ethnicity, share same languages, understand those languages, or share same background, a greater level of trust is developed between the provider and the patient. This means that patients are more likely to share in their medical decision-making, participate in preventative care, and adhere to medication plans. They spend more time together, and the provider's implicit bias is reduced. The COVID-19 pandemic has amplified the great need of care for our communities and the disparities that exist in Black and brown communities. One study found that Black patients with COVID symptoms were 6 times less likely to receive testing and treatment compared to white patients. This is unacceptable and exactly the type of inequity that Cook County Health and Cook County is trying to address through this program by addressing the issues head-on, providing new opportunities, and helping people be better in our county. by fostering medical professionals who are from the communities where opportunity is not abundant. We hope to create a healthcare delivery system that is representative of the patients that we serve and the providers that we care for, aiming to achieve high equity and quality care that is universally accessible to everyone. We're looking forward to welcoming our first class of scholarship recipients this summer and to growing the program for years to come. Unas palabras en español. Buenos días. Me gustaría comenzar mis comentarios agradeciendo la presidenta de Preckwinkle, los comisionados Dear y Lowry y la Junta de Comisionados del Condado de Cook y la Fundación de Cook County Health por su tremendo apoyo de nuevos fondos de becas del Hospital Provident. También me gustaría reconocer a Valerie Amos, Alicia Boyd y todo el equipo de Cook County que han estado preparando para lanzar este nuevo ecuanimante programa de becas. Gracias al generoso apoyo del Condado de Cook, la Fundación y sus donantes, este año podemos apoyar 60 estudiantes de escuela secundaria, universidad y escuela de medicina. Esos estudiantes son que quieren trabajar en las comunidades destantidas. Este año se ha a dar $1 millón en becas. Los solicitantes serán evaluados a sus logros académicos y también se considerará la comunidad de Cantido y donde esta comunidad se encuentra en la índice de vulnerabilidad social. El objetivo de este programa es brindar oportunidades a los estudiantes provenientes de comunidades que históricamente han enfrentado mayor desafíos y que sea educación, oportunidades económicas, transporte, acceso a los alimentos o atención médica. Como saben, nuestra nación se enfrenta a una crisis de personal sanitario. Debemos de desarrollar una cartera de proveedores médicos y queremos que sean de las comunidades y las vecindades de donde han apropiar nuestro equipo. Nuestro propio sistema de salud del Condado de Cook tiene una provisión de pacientes mayormente minoritaria. El 31% de nuestros pacientes son negros afroamericanos y 28% son hispanos latinos. Estoy orgulloso que nuestro equipo de cuidado médico es representante de las personas que servimos. El 59% de nuestro personal es negro afroamericano o hispano latino. Sin embargo, nuestro equipo diverso es una excepción en el cuidado de salud. También tener proveedores de atención que se parezcan y tengan las mismas mixtas experiencias, culturas de sus pacientes, menudo resulta en mejores resultados de salud. La evidencia muestra que cuando los proveedores y los pacientes son de la misma raza o etnia, se desarrolla un mayor nivel de confianza, luchando para adelante el cuidado de sus pacientes. Es más probable que nuestros pacientes es más probable que los pacientes participen en la toma de decisiones médicas, participen en la atención y preventan ser ajenos en los paneles de medicación. Pasan muchos tiempos juntos y reducen el ciclo implícito del proveedor. Estamos muy orgullosos para anunciar este programa hoy, que a luchar y avanzar un nuevo sistema de salud en nuestra comunidad que está abierta para todos los estudiantes, para toda la comunidad y a luchar adelante oportunidades para toda la gente del Condado de Cook. Muchas gracias. I'm now happy to bring forward the chair of our Cook County Foundation, who also contributed to this effort and made today possible, and we'd like to bring forward our chair, Joe Flanagan. Thank you.
Good morning, everybody. Good morning. My name is Joe Flanagan. I am pleased to be here representing the Cook County Health Foundation as the chairman of the board. I want to thank President Preckwinkle and Commissioner Dennis Deere for their steadfast support of the foundation. I also want to recognize and thank Commissioner Lowry and Israel for, again, all the support they have given the foundation over the years. Cook County Health Foundation was formed more than a decade ago with the goal of supporting Cook County Health and helping the health system continue its historic mission of caring for anybody with needs, regardless of their ability to pay. This is why we're so excited to be able to support Cook County's health initiative to invest in the future healthcare workers. I am pleased that the Cook County Foundation has raised $100,000 to support this year's scholarship distribution, and will be making the Provident Scholarship Fund an ongoing funding priority. On behalf of the foundation, I hope this will encourage other organizations to join us and offer their financial support as well. The pandemic has highlighted the importance of a strong healthcare system. These first responders and frontline workers have been there when we've needed them. They've been absolute heroes. And programs like this will ensure that together we develop the healthcare workforce we need today and for the future. Thank you, and thank you all for your support. And I'm pleased to announce Valerie Amos, Head of Human Resources at Cook County Health.
Good morning again.
Good morning.
I'm Valerie Amos, Chief Human Resources Officer at Cook County Health, and I'm so pleased to be here. I'd like to share a few details about the scholarship program. The Provident Scholarship Fund will be administering 60 scholarship awards this summer, including 30 to medical and dental students, as well as 20 to Chicago Public School students who are entering healthcare programs, and 10 to students in allied health undergraduate programs. And those programs will include respiratory, radiology, some nursing programs that includes both registered nurses and LPN programs. So as the first year to launch this significant scholarship program, we're looking forward to expanding the program on next year. In terms of the details, the medical and dental students will receive $20,000 as their scholarship, as well as the allied health undergraduate and high schoolers will receive $10,000 scholarships. Applications for the program will open today. And so online, you will see that those programs are open on our Cook County Health Careers website, and the applications will be open until May 26. So that gives us 30 days. Individuals who are interested in learning more about the criteria and application process should visit us again at cookcountyhealth.org/careers to find the scholarship page. In addition, we will also be posting information on our social media pages. CPS has an internal application process, and so in terms of their process, their main point of contact will be internal at their schools, their homeroom teacher. We are honored to provide opportunities to uplift healthcare students who are from and committed to serving communities that have the most need. As a nurse, it's essential for our patients to feel connected to the individuals who are caring for them. And it's equally important for our healthcare providers to understand the culture and life experiences of the patients that they are caring for. While we are proud of the diversity here at Cook County Health, we want to support a local healthcare workforce that embodies our mission and commitment to care for all. So a special thank you to President Preckwinkle, Mr. Rocha, the foundation, the commissioners, and all of you today. Thank you so much for your time today.
You're here.
Thank you.
All right, I am remiss, I didn't acknowledge Dr. Turner, who is our interim CEO here at Provident Hospital. Thank you very much for joining us, Dr. Turner. And the young lady on the end is? Alicia Boyd, okay, Manager of Workforce Development at Cook County Health. I apologize to both of you for not acknowledging you at the outset. My error. Questions?
We have Block Club Chicago on the line.
All right, Block Club Chicago.
Hi, will these scholarships be renewable every year?
Will the scholarships be renewable? Let's hear it.
Thank you. The scholarships are a one-time award for each student, but we will certainly have the program on next year.
Also, what dollar amounts will be given or awarded to each student, or will it vary?
So for the medical and dental students, they will receive $20,000 as a one-time scholarship. for the undergraduate allied health programs such as nursing, radiology, respiratory, as well as the Chicago Public Schools Scholarship Program, they will receive $10,000 as a one-time scholarship award.
And when is the deadline to apply?
The deadline will be May 26th, so the application process opens today, and the deadline will be 30 days from today.
Thank you. I appreciate it.
No problem, thank you.